Picture this. You've extracted a bunch of teeth. It's an extensive surgery. You've placed a couple of implants. You've done your bone grafting. And then finally, at the end of it, you've sutured everything and it's nice and secure and tight. And now you're planning some kind of prosthetic as a temporary. And if you need an impression, you are going to take maybe a special tray or a stock tray and you're going to load it up with impression material and take a very accurate impression. Now, as you retrieve that impression, to your horror, the impression material has now stuck to the sutures and you're having a hard time getting it out. You may need to reach out for a pair of scissors and cut out that suture material which is stuck to the impression. And of course, the patient is going to also be uncomfortable because that suture material is tugging at the tissue, and by this time, most likely the anesthesia has already worn off. Try to avoid this as much as you can. If it's a small segment, like in the pictures I'm showing you below, I would just use a little bit of Teflon to cover the sutures so that the impression material doesn't get caught. And if it's a larger segment, you can always use some rubber dam to get the impression material completely covered. Whatever you're using, make sure that that material adapts to the tissues well, because you want to capture as much detail as possible, and then you will see that you've not really damaged your sutures at all and you still have adequate hemostasis, a happier patient and a happier you. I hope I've confused you enough. Till the next time we meet, this is the Dental Review Guy signing off with a smile.